welcome. Today's this webinar is basically to discuss how mediCAD 3D knee. It is a premium solution for preoperative planning for orthopedic surgeons. This software is designed to improve accuracy, efficiency, and patient outcome in knee surgery. Today, this presentation is going to be focused on three different aspects of the software. Basically, I'll do a knee osteotomy, full knee replacement or arthroplasty, and then also torsions. If you want to see anything other than the three things I mentioned, you can please let me know. We can schedule a private demonstration, and then I'll definitely be able to showcase that to you. And if you do have any question, you can go ahead and ask any question at any time through the chat, or you can just come up on speaker and ask your questions. Why is preoperative planning is important? Well, traditional planning methods are time consuming and may lack precision. And then a lot of the time, PAC system sometimes includes some basic planning software. And most planning software is likewise, it doesn't allow you to do a lot of different measurements and so forth. It's also time consuming. But with planning software, surgeons need tools that reduce surgical time, errors, and complications. The mediCAD knee provide a comprehensive digital solution that enhance surgical decision making. The software, this is the mediCAD knee. You can access CT and X-ray files. It's very simple. You have different toolbars on top and files. You have different options, new planning. You can load existing plan that you had already worked on. You can save and save as. You can also export it to your PAC system. And you have your setting right here to configure it with your PAC system. And also you have help. Help has menu. If you need help, you can request for live assistance. And then also there's also all these different resources here to make it easier for you. But yeah, as I mentioned, the software is very simple and easy to use. Just need, maybe an hour or two just to navigate it, get to use to know where the tools are. Most of the measurement can be done automatically, but can also be done manually. Why mediCAD 3D knee stand out of all the other planning software? It does enhance accuracy by, using 3D visualization, eliminating guesswork, because a lot of the planning software are available in 2D, not 3D. It is FDA compliance, ensuring regulatory compliance for safety and reliability. Also, it saves you up to 90%, than traditional planning. You can seamlessly integrate to PAC system, directly import images from hospital imaging system. Our system has over 500 templates from 130 manufacturers, which makes it unique. So basically, if you currently working with a templating company, I'm 90% sure, or higher, 99% sure that it's already in our system. And if you do add a new templating company or change templating company, you'll find it in there. So that's mainly the main benefit of having all these different manufacturers in there, because most planning company don't have that. You have to plan with another brand, right? But you'll be planning with the one that you currently use. So first, let's go ahead and do a single osteotomy plan to see what it looks like. And basically, we'll use X-ray image. You just have to select it. And once you select it on the bottom, you can click Start Planning. And you have this image. Sometimes if the image has a scaling sphere, the software will automatically scale the image to calibrate it. But if it does not have a scaling sphere, then you have the ability to scale it by 3-point, by SOCO, 2-point line, or magnifying factors. For this one, we're going to do magnifying factors, 100% scales, and this is an AP view image, and then you just have to click continue. mediCAD 3D knee enables precise planning for HTO, DFO, double level correction, and rotational ischiotomy. Once you scale the image, you basically select which side of the anatomy position you want to work on. And this, for this patient, it seemed the left side probably be most likely the one that need osteotomy. We'll go ahead, and you have to always segment it before you start. This is the reason why the AO osteotomy is not, you cannot click on it, right? Prevent you from clicking on it is disabled because you have not done the segmentation. So you must click the segmentation. It will automatically do the segmentation for you. So which saves you a lot of time. So that leads to, takes you fewer time, and then, do more planning and see more patient, in turn make you more money. AO osteotomy, once you've done the segmentation, now you see the AO osteotomy is, you can go ahead and click on it. And once you click on it, you can see that the software automatically detect the landmarks for you, add some of the measurements, and the software says that this patient, the left side knee, has a 7.87 degree of varus, and then they show you all the other measurements. The weight bearing right now is 13%. And so let's go ahead and just check all the lean back to make sure everything is correct. It just makes some minor modification, and then everything I believe should be fine. You can manually make correction, and you can see that the JLCA is 3.0. We need to be under 2 degree. So we'll just have to fix it to get it to under 2 degree. Okay, now check the ankle. And once you satisfy, you just have to go ahead and click accept and continue. It's very easy. The software make a recommendation for the HTO for single osteotomy. You just, let's zoom. Okay. So you just have to confirm it. If you if you agree with what the software recommended, you can click confirm. If you don't agree, you can hit menu correction and do the correction yourself. So for this demonstration, I'm gonna hit confirm. And then you can see that the software automatically add the line for the cut. You just have to make a minor adjustment to where you want to cut it. And so once you've done that, you can go ahead. You can make any adjustment here for the correction objective. You can change the valgus, the weight bearing. So this is the recommendation. I'll keep the recommendation. Since I'm not an expert, I'm not a doctor anyway, but I'm an expert of using the software. So, but the recommendation the software makes, I go ahead and accept it. So as you can see that the software make the correction, you can see that the valgus now is 1 degree angle and the weight bearing is 53%. And if you want to make adjustment, manual adjustment, you can also make manual adjustment by click on the tibia and then move the tibia back and forth until you get to where you want to be, right? And if you see that I make the correction and the software automatically say, hey, wait a minute, the MTFA divide more than 20% from the correction target, right? So you can fix it based on your expertise. You can make adjustment. You can just continue with what the software made and the recommendation the software made, and you can see the weight bearing change to 52% and so forth. It makes it very easy. This is something normally when I speak to surgeon, when I show this presentation, they explain to me how long it takes them to do this, and they see how fast our software can do this osteotomy with that much accuracy, and where also they can use the expertise to do it the way they want to based on their preference. You know, they're always amazed with the software. So this is what the osteotomy is, and then once you're done, you click close function, and you can start templating, right? You know, you add the component that you want. Let's say knee. I don't know if this one has any nails. I don't know which company that has any nails on this one. Nope. Plates or nails. But yeah, you can add the component here. It's I don't remember which company that has it. But once you, I guess once you're done and you're satisfied with it, it will automatically save to your PAC system, but you can also save the plan as or print or export the plan, and it will basically allow you to save it as a PDF on your computer. You can email it, forward it to your staff for them to prepare for the surgery. It will have the patient information because it'll allow it to enter the surgeon information and also patient information. Let me, as you can see, normally prior to all this, the surgeon is able to enter the patient name, patient information, and the surgeon information. And then you have the measurements before and after. And then you have a picture of the x-ray before, and then you have a picture of the same x-ray after the osteotomy is done with some of the information in there. And then also a zoom in screenshot. If you add any component to the tibia, or like a nails or plate, whatever you use, is also gonna show you the measurement for that, and then also gonna show you the exact plate or nails that you have used on the plan. So this is the demonstration for the osteotomy. It's very easy to do. I can show you a double osteotomy using the same image. Let's go back. This X-ray doesn't really like fit the criteria for a double osteotomy, just for a single, but I'm gonna manipulate the measurement to make the computer recommend a double osteotomy. So you can see that even for that, the software can recommend it. Same process. So it's just here, I'm gonna have to manipulate the everything red. Let's say it was like something like this. Yeah. See, the software make a recommendation, double level osteotomy, media closed wedge AFO plus, media open wedge HTO. So go ahead and confirm it. And the software at the first, from the first cut. Out of range. What happened to my second cut? To close it. I guess it wants to stay where it is, so. The weight bearing is 48, but that gave you an idea of the double osteotomy. You can perform a double osteotomy. Again, it's based on your expertise as a surgeon. You can get it to where you want it to be. So you understand exactly what you need to do. But it's just to show you that with the software, you can perform a double osteotomy. As I mentioned, this image did not fit the criteria for a double osteotomy, but I just mess up with the measurements to make it seems like for the software to detect it and recommend a double osteotomy. So now we can go ahead and show you what the torsion looks like. Torsion with this one. The software is definitely AI driven. It automatically perform bone segmentation and landmark detection, which reduce a lot of the manual work. And then it is a hybrid, 2D, 3D system with X-ray and CT, scanning for comprehensive approach. And then you have expert mode, and then you have quick TKA super children at every steps. Export mode is basically you do everything manually. Quick TKA does most of the measurement manually for you. Templating, that's just you doing it without any measurement. You just want to do templating. And then this is the free mode. You just do measurement with templating and so forth. You can do deformative correction, patho low thermal measurements, and then as I mentioned, torsion, and then also 3D printing. Again, as always, you have to do the segmentation. Oh, I forgot to remove the table. So you can manually remove the table, but I recommend you do it automatically because the software does a really good job and it takes less time, and then you can also denoise it. So we're gonna go ahead and do it automatically. And I'm gonna resegment it again because it will be more accurate. And then another benefit of us having, the most amount of templates in our database and plus over 120 manufacturers. The fact that the surgeon can test different implant option in real time. And another benefit, which when there's when I do hip replacement measurements and so forth, there's one of the example we have of a CT, and then the femur is very, very thin, very, very small. It's like maybe it seems like it might be a child, right? So it requires like a special component. Most company don't have it. So normally I have to search. There's a specific company. There's maybe two or three templating company that has one that fit. So, I'm sure that a lot of the doctors sometime you will want to, a patient where you don't have a template that fit them because it's too small. They need something very, very small because of the femur is too thin, right? So by having this ability, you were able to search within our system to see exactly which one that fit. And by knowing which one that fit, then you'll be able to, order that from the company directly. So, and then also you can request a 3D printing of it, and then which you can use to test to make sure this is the right solution. So now that we done the segmentation and then we remove the table and denoise it, and just to let you know, the software used the CT to generate the 3D. This is the 3D right here. You can zoom in, zoom out, and then you can, move around different angle to look at it. But you can zoom as much as you want to, and then you can also move the image up and down. So we'll do a torsion. And then because of the software, and then I mean it makes it very easy and fast to do the torsion. This software really is a premium software of for orthopedic surgeon, for and when it comes to planning. We've been in the business for over 25 years. Before a lot of these digital planning software was available, mediCAD was already operated in Germany, providing this solution to surgeons. So we now in the US trying to open the market in the US for the last 2, 3 years, FDA approved here in the US. And we want to provide this amazing solution, which which is very, very popular in Europe, in Asia, and other countries. So I'm sure that here in the United States, it will cut on too. So this is the torsion. As you can see that it was very fast and very easy to do a torsion measurement. And then you have, tibia and femoral torsion. And the same thing too. You just have to click back to the menu and then to go back. And then now you can go ahead. I'll do a quick TKA for knee replacement as my last part of the demonstration. Okay. The software guide you through the measurement. So the first one is basically the joint center line by 3 point, and then the greater trochanter measurement. And then the distal femoral joint line measurement. And as you can see on the top left, the software is guiding you on how to do it. So if you have not used the software before or use another software like so, the software does guide you, and then it also has a quick guide menu, and it also have a actual menu which has more information. Any questions so far? And once you used to this, it's 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 very easy to do all the measurements. This was the tibia access points, and then now just doing the flexion axis. So now the measurement is done, and you can see that it shows you the values on top, and then the also the value on the bottom. So it says just before and after. Insert the component and so forth. You will maybe see some changes. Same thing, you can move the CT around, and you can move the 3D around also too. This is the export mode, but it still allow you to do some of the measurement automatically. If you click on it, allow you to do it manually, or you click auto, it'll just do it automatically. And you just have to click the femoral tibia resection to do the resection on the tibia, and it will automatically do it for you. And now it's done, then we can go back to the implant and reposition it. You have the glass view. The glass view is transparent. It helps you visualize. It helps with visualization, allowing for better positioning for the prosthetic component. And as you can see, is you can see it a little bit much better. Yeah, it looks much better now. You can change the angle to make sure the component is in the right angle in there. So, as I mentioned earlier, you have the previous measurement, and then after inserting the component and then the resection, and you can see that the the measurement has changed. Some of the correction has been made. So instead of some here, you can see that it's red here, and then here it's yellow for the MFA. Once you done here, you just click exit if you feel like the position is correct. Again, based on your expertise, if you feel like the size of the component is the right size, you can always change the size, move it, change angle, direction. You can zoom in really close to see. And then you can, if I go back and you click transparent zoom, glass view for the transparent, it will show it to you very close so you can actually look at it. You can hide the femur or hide the tibia and remove the transparent and just have the component only. Hide both tibia and femur. and then just move it around to see. But the glass view allow you to see, let me put tibia on it, to see how the component is sitting inside the bone, if it is centered correctly. So exit, see what the plane looks like. So same thing, you have the patient information and surgeon information, and you have the 3D screenshot. You have the formal component, the what manufactured, what product line, and the size of it. So again, has the staff is preparing so they can get the right component ready. And you same thing too with the tibia component, and you have a image of it, and then you have all the measurements here, so they know exactly what tool to get based on these measurements to prepare for the surgery. Again, more of the measurement on the plan. And the plan is good to have because you can always use the plan to talk to the patient also too before the surgery. So the patient know exactly what's going on and able to have a little bit more understanding. And then for post-operative planning, they can use this to analyze it and with the post-operative planning and for better outcome. So this was the presentation for the 3D knee. So definitely to summarize, it's definitely more accurate. It has AI. It is AI assisted surgical planning, faster procedure with reducing intraoperative adjustment, improve patient outcome through better alignment and implant positioning, seamless pack integration, regulatory compliance, and the plan is also regulatory compliance. If you are get audited, you have the plan to show that you follow the proper steps and so forth. Right. And then so this, I know a lot of surgeons say the three thing that the number one thing is is legal. And then thing is they want to make more money. And then third thing is they want to save time and be more efficient. So this software allow you to prevent legal issues, help prevent a lot of legal issues, and then help you save a lot of time, which you basically you can do more planning and more surgery, which in turns you make more money. Also enhance preoperative simulation and 3D printing support, right? This was the preoperative planning, so we went over AO osteotomy for both single and double osteotomy, and also torsions and 3D knee for arthroplasty. We do provide free trial, so if you're looking to test it out, we can provide you with a free trial, and you just need to provide me with your contact information, and then I'll set up the free trial for you. And then also, if you like to have a more private demonstration, you would like to see more and more like kind of like an engagement setting, you can ask any question. You can also request for that. Then I'll end the webinar. Again, thank you for participating. You can always go to medicad.us for more information. We also are on YouTube. So you can go to YouTube and type mediCAD software. It makes it easier for you to find it. And we have tons of videos on there. And then also you can reach out to us on LinkedIn. But on our website, there's a contact page. You can reach out to us.